Yeah, it's been a while.
It's been a while.
Wow, set it up for them guys. Friday at 4 too. Still too bad. 20 years nonstop.
Perfect. I broke a couple of laws, but it's okay. Okay, cool. We're ready to come in.
Why is that funny?
You see how fast they file an appeal? You don't want to.
I was going to ask if they've already kind of asked, like, the appeals to come over for this day, do they just do the same thing, but against the deferred injunctions, or like a new matters?
Yeah.
But like, they can still do court first.
I think Andy, I think it's me, Justin, and Andy, and then everybody's available for questions. Is that how we're doing it? Okay, so me, you, Andy, and Joe. Okay. And then everybody's available for questions. Dr. Wu's here for questions. Eric.
Yeah.
Okay. So, yeah, okay. You want me to just play MC then? I'll play MC then.
Yeah, all right.
Okay.
Yeah.
Just just hand it off to the next person. Okay. All right, good afternoon. Obviously, we are pleased with today's district court ruling granting a temporary injunction. With a temporary injunction in place, Dr. Wu's health directive requiring masks in schools remains in place too, and that is great news for San Antonio and Bexar County residents. Of course, we do realize that the battle is not over. We expect the state to appeal the judge's decision, and we'll be there to defend our school children every step of the way. Regardless of the eventual outcome in court, every day that our unvaccinated children are protected at school by masks is a win for our entire community. Remember, children under 12 are not eligible for the vaccination. The Delta variant is deadly and highly transmissible. That is indisputable. The rapid spread of this dangerous variant led us to seek this injunction, so Dr. Wu's guidance would be a requirement. We can't sit idly by while our children are being forced into harm's way if we don't act. We don't have the luxury of just hoping this virus will go away. And I want to thank City Attorney Andy Segovia and the whole team of lawyers, including the county, who have been working on this case, as well as Dr. Jinda Wu for their efforts. Now I'll turn it over to Commissioner Justin Rodriguez.
Great, thank you, Mayor. And I also want to thank our legal team, both from the DA's office and the City Attorney's office. As you mentioned, a victory today. We hope it's not short-lived. We know that sometimes these legal disputes kind of go on for a little while, but what we know, and it was reinforced this morning, I was out at Sol Ross Middle School in Northside ISD, visited with teachers and staff, and then we went and knocked on doors to remind kids and their families about school starting next week. And what it underscored for me was that we're on the right side of this battle. We're on the right side of this fight. Every person I spoke with wanted to make sure we did the right thing for our kids, and that was making sure they wore masks and that we listened to public health professionals like Dr. Wu and those in our community who say this is the best way to fight this pandemic. So again, very appreciative, and again, thank you to our city attorney, to our DA's office. I want to ask Joe to come up and say a few words.
Thank you, Commissioner. This is a cause for celebration. We now have this temporary injunction that was granted by Judge Arteaga. I want to take a moment to thank her for the careful consideration of all the evidence and all the testimony. This hearing took all day long. She heard from all the witnesses that both the city and the county offered, and I want to thank her. And I think this is another indication to the citizens of Bexar County and the citizens of the city of San Antonio that you can rely on your legal system to work hard for you. So we are going to take a moment to celebrate this. We don't know yet how long it's going to last. We certainly expect the state to appeal this decision. We know that there's going to be a trial on the merits, but I do want to underscore the importance of the testimony that we heard today. I can't understate the importance of Dr. Wu's testimony about the fact that we're at a critical stage here in this county. We have the numbers of hospital beds that are dwindling, and what's different now from last year is that we have 1,600 less hospital employees to deal with. So as she said, even though you may see a hospital bed, even though you may have a ventilator, if you don't have the personnel to care for these individuals, that's the real problem. And so I want to thank everyone today that testified at the hearing, and I want to thank the city of San Antonio, the city attorney staff, and of course everyone involved in the DA's office in the civil section for all the hard work that they put in to this case. Thank you very much.
Thank you, Joe. Some of this is repetitive, but I think it bears repeating. Obviously, we're pleased with the ruling. We also want to thank Judge Arteaga. As Joe said, it was a day-long hearing. There was a lot of evidence. There was a lot of witnesses. And obviously, the judge considered that in her thoughtful decision. I do want to thank, as Joe said, I mean, it's a team effort. I want to start first with my team. There's been a lot of hours put in, obviously, in this. So we start with Liz Provenzo, the First Assistant City Attorney, Debbie Klein, our Head of Litigation, Bill Christian, who put on our case for before the judge this afternoon with his colleague, Marianne Nietzsche. So we thank them tremendously for the effort. As everyone's noted, every day that we can keep the mandate in place is another day for the community where which we can really mitigate the spread of the virus. So each day we look at it as a major victory for the community, and we hope that we will keep the momentum going. As Joe said, we fully expect the state will probably appeal. We'll be prepared for that, and we just hope we can keep the momentum going. So with that, I'll turn it back to the mayor.
Great, thank you, Andy. Again, thank you to our legal team. Also want to thank folks who appeared as witnesses for our side, and that includes Dr. Wu, our Bexar County Public Health Authority, as well as Eric Walsh, our city manager. So with that, Dr. Wu, Eric Walsh, our Metro Health Director, Claude Jacob, Commissioner Rodriguez, DA Gonzalez, Brett Piet, also with the county side of the litigation, and then our city attorney, Andy Segovia, Bob Piet, I'm sorry, are here to answer any questions that you might have.
Can we ask you about how confusing this is for people? Because last week there was the TRO put in place,
right.
Then the fourth court of appeals held it up, the Supreme Court struck it down, now we're back to almost the same place we were last Tuesday. So tell me, what do you want to do to reassure people about how this legal process is unfolding?
So again, realize that this is very confusing if you're following the legal machinations of this, but it is very simple. And that is the CDC guidance and how we can keep people healthy and safe and frankly alive in this community. We have record numbers again today. The simple truth is masks work, vaccines work, and we need to use them if we want to put an end to the pandemic. It's as simple as that. So regardless of the outcomes and what's going on in the court case, our guidance is very simple. Follow what the CDC is recommending, follow what our public health authority has been saying, wear a mask, particularly in a school environment, and get vaccinated if you're eligible. Commissioner, I don't know if you want to.
No, I think you hit it on the head. You know, I am a lawyer and sometimes, you know, practice every once in a while, but this is confusing to our community. I think what the mayor said hit the nail on the head, and that is whether, you know, you're in a school, whether you're in a public building, any facility, the safest thing to do is to use a mask. For those that can get vaccinated, we encourage them and plead with them to get vaccinated. What we know about the public schools, really all the schools, is that those under 12 are not eligible for the vaccination. So I think that's the importance of why both the CDC, our public health director, have stressed the importance of mandating a mask in those environments, because we know not just amongst the kids, but when they go back home to their parents or grandparents, they have the potential to spread COVID. And so that's why this is such an important ruling today.
Mayor, there are some parents that are thanking all of you guys for what you're doing regarding masks in school, but there are also some parents that are very upset with the decision of today. What is your message to those parents?
Again, it's very simple. We are, as a community, as a public, responsible for the public health, and we all need to do our part to get this pandemic behind us. We have seen so much death and illness in our community. We all want to see what's best, and that is for us to community, our kids, our community in general, to be healthy again. And so that is our focus, and then realize that, you know, we are all for personal responsibility, but we have an obligation to the public health in public places, and that includes in public schools. And that's why the guidance is very clear. We have to protect those around us, we have to protect ourselves, and masks and vaccines are the tools that we have to use.
Mayor, SAISD has a mask mandate for staff and students. They also have a vaccine mandate for employees. What's your reaction to this one?
Good on them. I think that the health professionals will tell you that if we can get folks vaccinated, we can make sure as many people are vaccinated as possible. They have the ability to do that, and they're utilizing those tools. They're going to have a safer environment than when those tools aren't used. So again, appreciate the leadership that some of our school districts are showing through a very difficult time.
Mayor, on the note of the back and forth for parents and stuff like that, how far are you willing to take this? Is this until the numbers go down?
I'm sorry, could you repeat that, Zach?
Just on the note of parents in the middle of the back and forth, how far are you willing to take this? Is this until we see the numbers go down and it goes away, or until the governor relents? What happens?
Sure. You know, as we've stated from the very start of this pandemic, everything we have done to execute our strategy to respond has been guided by the health professionals. So it's, if such time as the CDC guidance changes and you see our public health authority guidance changes in response to that, then our strategy might shift. But until then, we're going to do everything we can, every tool we have at our disposal to clear the way for that health guidance to rule the day. And that is for the benefit and safety and health of our entire community.
Dr. Wu, during your testimony today, you had said that with the Delta variant, it's like every one person that's infected is infecting potentially 8 to 9 other people, when the original variant was, when the original virus was probably spreading between 1 and 2 people. Could you elaborate on that?
So another analogy that people use is it's as contagious as chicken pox, and I don't know that you would want to send children to school with chicken pox. You know, so this shows the importance of having. Well, all right. I don't know if this analogy is working out. It's been a long day. It's as infectious as chicken pox. I'm not clear on what else you want to know, because those numbers are the numbers.
Right, and that's the first time that I had heard it, at least, and so I'm curious as to when the Metro Health and you have come to that realization that the Delta variant was spreading at that capacity.
It's from a leaked CDC internal document that data is coming to us. But the schools, if you just look at the experience, the real life experience of the schools this year, they have said we're having more outbreaks, we're having more student-to-student transmission now than we did last year when we were using all these precautions. So the Delta variant is different.
You'd also said, quote, "I'm worried we're going to break our healthcare system." Could you talk more about that?
Yeah, it makes me really sad to talk to my colleagues who are in healthcare these days. It's been a really long time. They're dealing with, at this point, people who are in the hospital for preventable illness or in some cases preventable death. And we're asking them to work in a more short-staffed way, as you mentioned, or somebody mentioned. You know, we have 1,600 fewer staff in the hospitals now than we did during the previous surges in June and December. So we're actually asking people to work harder a third time. Burnout medical care is not the medical care that any of us wants to get. People are tired, and I do worry that we're going to lose people from healthcare permanently. Actually, we already have, but I'm worried we're going to lose more.
I have a question for Mr. Walsh. Can you talk about this latest COVID surge, how it strained our healthcare system, and what's going to be the impact for city services?
So, as of today, we have 6 city employees in the hospital, and our total city employees that are out and positive is 169. So that number continues to increase. We're before April, we saw an average case rate of about 18 cases per day within our 12,500 employees. At the end of July, it was 33. And since August 1st, it's come down slightly, but still higher than anywhere in the last 18 months. So obviously, one of the factors in the lawsuit or in the case today is the primary point is the Dr. Wu's order to schools, and for many of the reasons that the commissioner and the mayor talked about. The second point is, as an employer, being able to require masks for employees, which is the case for the city of San Antonio since August 11th. And We'll continue with today's ruling. We'll continue that for employees and for visitors to city facilities. So it's critical so that we can maintain the level of service, whether it's the libraries or fire or 911 dispatch or the airport or solid waste, that we can continue to meet the staffing challenges and provide that service to the community.
A lot of people are worried, because of the trash and things like that. What do you want to say to the people out there in City of San Antonio?
Don't worry, we got it. That's why we have a mask.
More of a legal question. So are we just, we're expecting the state to appeal. Do we know when our next hearing could be? And then where would that go in terms of that hearing? Who would oversee that?
I'm gonna let, you mind, Bob?
The next logical step would be an appeal to the fourth court, the appellate court, in terms of appealing the temporary injunction. However, we've already seen the governor try to go directly to the Texas Supreme Court. There's some things pending before the Texas Supreme Court. So it could be either one of those avenues, and it could be any day. So again, we'll be prepared to do that. But we'll obviously let you know, or you'll find out as there'll be an official filing. And as long as I'm up here, I was remiss not to thank Joe and his team for all their effort today, and the county cooperation was key in terms of our success today. So again, thanks to the county for all their help.
Just for clarification, Andy, sorry. So if there are things still waiting at the Texas Supreme Court, does that have the potential to kind of throw a wrench in the process? Like, what is still pending?
It's the writ of mandamus that they filed with the TRO that we got last week. When the Texas Supreme Court issued their order on Sunday, they made it very clear that they hadn't ruled on that yet. They also made it very clear that they wanted our hearing today to proceed. That's what's still pending before them. Or there could be even a separate appeal, a separate writ that the governor may attempt. So obviously we'll be on the lookout on whatever happens.
But does that current mandamus in the Texas Supreme Court, is it still valid if the TRO expired? Like, we're past that.
Obviously we would argue no. We would argue no. That's a good question. Yeah, we would argue no. It would probably be a separate one.
I'm sorry again for the little nitty-gritties, but so if we expect an appeal to the fourth court of appeals from the state, would they have to wait for the fourth court to do anything before going directly to the state or to the Texas Supreme Court?
That's normally the procedure that they would follow. Yes.
But it's possible they could circumvent that.
They've tried to do that before, and so yeah, it wouldn't surprise me if they attempted to go right to the Texas Supreme Court.
And what was the tentative date set for the permanent injunction hearing?
The tentative date was sometime in December. But again, that's a requirement to set a date. Whenever you have a temporary injunction issue, you're required to set a date.
Do we expect that to be earlier?
No, I would say that date will probably hold, because again, I think the next expectation is it'll probably be before appellate courts.
I do have one more question. We talked a little bit broadly about parents being confused about the mask mandate, especially if they're following the headlines. You know, it's all kind of complicated and convoluted.
That's your department, Jay.
Yes, so I think we're all trying to do our best keeping everybody apprised.
Right.
But as far as local, like, this is what you should expect, like, how are you guys trying to streamline that communication for everybody? Parents trying to make the best decision for their kids, kind of worried about what to do, all of that.
I'd like to ask Claude to come up here, because that's the essence of our communication strategy, which is mask up, get vaccinated. It can't get any simpler than that. Regardless of what's happening in the courts, the science has not changed. We need to stop the transmission and get this eradicated by getting folks who are eligible vaccinated, and everybody in the meantime, because of the surge of the Delta variant, needs to be masked up. Claude?
Yes, just know that at the end of the day, we're still in the throes of managing this pandemic and the infodemic. So we do have a call later this evening with the superintendents just to clarify the messaging. We want to make sure that parents are clear, that teachers are clear. So just know that there's a lot that's been happening this week over the last 5 or 7 days. But at the end of the day, we're refining our messaging. We still have our pop-up clinics. It is still National Immunization Awareness Month. We are promoting the vaccines. We are making sure that folks still have access to the free COVID testing and the COVID vaccine. So just know that we'll be chatting with the superintendents later this evening to clarify any instructions and messaging for parents and teachers alike.
And what have the superintendents been saying in terms of that confusion? Because I know some people were like, we're going to hold off until more things come, but now that we have this temporary injunction, is there kind of across the board buy-in?
So at the end of the day, clearly, you know that we have a number of school districts, so that's why we scheduled a call to follow up, just to make sure that they understand Dr. Wu's order, but also clarifying what today's actions are all about. So that is scheduled later this evening. We're making sure to clarify at least the instructions to the schools and parents alike. So just know that's been the biggest challenge of COVID, right? The situation continues to evolve. We continue to be nimble, and I do want to applaud and thank our county level and our city partners for helping us at least promote and keep our children safe.
This might be a question for Andy, but what happens if the school district does not want to, within Bexar County, does not want to put in a mask mandate?
I guess it's your turn. Look, as you had noted earlier, I mean, there's a lot of confusion, and then we don't want to play ping pong with the public. We would expect all the school districts, because we did get the temporary injunction, to comply with Dr. Wu's order. But right now, there's no set thing in terms of what we will do. For example, if somebody comes out and says they're not going to comply with it. I mean, again, I'm going to leave it. Hopefully that the discussion that will be had this evening with all the school districts, they will be convinced that it's essentially just the right thing to do.
And quick question before you, I'm so sorry, Andy. I understand that y'all are waiting on an appeal to the 4th Court. That could still go to the Supreme Court for the temporary injunction. But if the trial on the merits of the case isn't until December, I mean, school's going to be out. I mean, we hope the pandemic will be more mitigated, right? We hope we're not in a weird surge again. So what does that, like, can the Texas Supreme Court rule against the injunction and say, like, you can't have this case, don't do it, or does it still have to go forward? Like, can they block the injunction?
So procedurally, if I understand your question, procedurally, if the Texas Supreme Court stays or lifts the temporary injunction, you still have a trial on the merits, but we're back to where we started, which is the governor's order being in place.
Okay, so hopefully that doesn't happen because then you have this long gap.
That's correct. Again, our aim is to mitigate the spread, and frankly, we're hoping that by December, there'll be enough people vaccinated, there'll be enough people wearing masks, that it would be one where we wouldn't even have to have a trial because we already have, you know, much better control of the pandemic. So we're still hopeful that it's the mitigation measures that'll make the most difference, not what happens in a courtroom.
Would it be too soon to say if you guys would try to move the trial date up if the Texas Supreme Court were to block the temporary injunction?
I think that's a little bit too early. That's like thinking 10 chess moves ahead. We're not there yet.
So this only applies to Bexar County, right? No other district?
No. Just to the city and Bexar County.
Okay. All right, thank you all.
Thanks.